Okay, thank you very much, Scott, and thanks a lot, Adam. This is a great introduction. In particular, the objectives have been well outlined. Thank you very much, colleague. Good afternoon or good morning to everyone, depending on where you are. So welcome to this excellent webinar. And the title is very inspiring, and we have eminent speakers as well with us. Started with Professor Diallo Morgan, who is one of the guru in risk assessment. And I will introduce the high-level panelists first. We have Dr. Raji Tajudeen. He is the coordinator for the establishment and strengthening of national public health institute across the African region. And he will speak first. A welcome remark will come from him. And as you all know, the institution, Africa CDC, they cover 55 African Union member states, and he will welcome us. Then after that, we will have Dr. Osman Dar, who has two hats. One is really leading the global health and global operation, because and then he is the director of One Health project as well. Then we will finish with Dr. Amadou Diallo, who is the regional advisor. He works with us here. He is the key leader for health risk management and country preparedness. He is based in Dakar, working for WHO Afro. Osman is in the UK, and Raj, my friend Raj, is in Addis. If I am wrong, you just let me know, please. Welcome. Raj, Dr. Raji Tajudeen, you have the floor for the opening remark. Thank you.
All right, no, thank you, Tieble, for setting the stage for this very important and timely workshop. On behalf of Africa CDC, I would like to welcome us all to this important workshop that is looking at adopting a One Health approach to zoonotic disease risk assessment and risk communication. So thank you all for joining us today. Colleagues, ladies and gentlemen, we are witnessing repeated outbreaks on the continent. We have seen COVID-19 all over. We've seen monkeypox in places where we've never seen them before. We've seen Marburg, and currently we are also seeing Ebola in Uganda. Colleagues, you will agree with me that to address this recurrent health threat, there is majorly of animal origin, there's a need to adopt a One Health approach that bring together different relevant sectors to share expertise and manage risk holistically at the human health, animal health, and environmental health interface. You will also agree with me that to assess the potential risk of this outbreak that of animal origin, it will be very crucial to adopt a One Health approach that emphasize a systematic and multidisciplinary process of gathering, assessing, documenting, and sharing information and joint surveillance capacity to estimate the risk over a specific period and within a defined geographical area. The establishment of risk communication and risk management strategies to mitigate effectively the risk level at individual and the community level is critical. Risk communication, or our risk communication, as much as possible, should be informed by science. And this also requires consistent information and messaging from the different relevant sectors. It is also critical to engage the communities so that we understand the social and cultural norms and build the much needed trust. We've seen erosion of trust capital as far as the COVID-19 pandemic is concerned. And this is one of the things that's allowed that pandemic to linger up to today. So the only way to guarantee the adoption of effective and comprehensive disease mitigation practices is to ensure that our communication is informed by science. In order to guarantee our member states, 55 member states, 1.3 billion people, health security sovereignty, the African Union, head of state and government have called for a new public health order that is underpinned by critical pillars like strengthening of public health institutions on the continent, expanding health workforce capacity, building local manufacturing capacity for health security commodities, local resource mobilization and domestic financing, and last but not the least, respectful and action-oriented partnership. You will agree with me that the workshop today clearly aligned with the AU new public health order. Distinguished colleagues, to conclude, I urge you all to bring the whole of yourself to this workshop so that at the end of the day, we can say that we have achieved the set objectives. That is looking at the principles of risk assessment, looking at how do we jointly conduct risk assessment. There's also looking at principles behind risk communication. And last but not the least, that will also allow us to share experiences from where we are all coming from. On a final note, I would like to thank the organizers of this important workshop for putting this together. And I also like to thank colleagues or distinguished colleagues from member states for availing themselves for this important workshop. I wish us all a successful deliberation. Thank you, and over to you, Tieble.
Thank you very much, Dr. Raji. Really, Tajudeen, this is an excellent opening remark. Now we will move to Dr. Osman Dar. Osman Dar, you have the floor, please, to welcome participants and panelists.
Thanks, Tieble. I just want to introduce the workshop and the series, the genesis or the history of these workshops a little bit to the participants so they know and understand where we're sort of coming from. So this series of 4 workshops is taking place under the umbrella of the Pandora research collaboration. This is a European developing countries clinical trials partnership, EU-funded collaboration between Europe and African institutions. What's been really special about the Pandora experience over the sort of last 4 years is that this has been an equitable partnership between European and African research institutions. Our PI is Francine Ntumi from Congo Brazzaville, and we've had the privilege of being partnered with the normative technical agencies operating in the African continent as well. So Africa CDC, where we developed an MOU between EDCTP and Africa CDC, as well as the quadripartite agencies, WHO, particularly WHO Afro, the OIE, which is now WOA, FAO, and as well as UNEP now that has joined recently, the tripartite to become a quadripartite. So we're very pleased and privileged to have been working alongside all these agencies in supporting the capacity building efforts across the continent. So in relation to this series of workshops, this is the 4th workshop in a series of 4 workshops, which has been focused around building skills for research and operational outbreak response using a sort of One Health approach. The other workshops, the previous workshops have focused on research ethics during epidemics. There's been one on integrating social sciences into One Health research during epidemics. There's been one on One Health research tools for preparedness and response. And there's this 4th one, which is on zoonotic risk assessment and risk communication. So this is a culmination of a long series of workshops, and we've been very fortunate as well with the workshops. We've had participants from over 70 countries, so there's 55 African member states, but also from further afield, from Europe, from Asia, from Latin America, from North America, participating in the workshops. We've had around 400 to 500 participants at each workshop. And it's been focused on those rapid responders from national public health institutes, from ministries of health, who actually are part and parcel of a successful response. So again, we're very privileged and honored to be hosting this. We couldn't have done it without the partnership of Oxford University's global health network, which then hosts, curates, and archives the workshops. And this is just a note to all the presenters. Long after you are dead and buried, your presentations will still be floating around on the internet. So make sure that they're good. So with that, thank you again to all the presenters and all the participants, and we look forward to a successful workshop. Back to you, Tieble.
Okay, thank you very much, Dr. Osman Dar, for the brilliant introduction as well, and all the support you provided to the continent and at the global level as well. Okay, now we move to Dr. Baïlo. Dr. Baïlo, you have the floor, please.
Thank you, Dr. Tieble. Dear colleagues and participants, on behalf of WHO Africa, welcome all of you to this workshop. As you know, the world is changing and very few public health risks stay with us within national boundary. The World Health Assembly has responded to this change with a comprehensive IHR revision in 2005. SARS-CoV-2 has led to loss of about 3 million lives and 16 trillion USD to globally economy. Globally, the African region responded as heavy burden of public emergency, with more than 100 major public health events taking place annually. The negative impacts of public health emergency are particularly profound in fragile and vulnerable states, which most of the member states find themselves in. In the recent years, certainly, progress has been made to support country readiness to identify and respond to range of emergency situations using the One Health approach. All African countries in the African region has adopted and are implementing One Health approach. Collaboration between human, animal, and environmental sector is instrumental in adequately addressing zoonotic disease outbreaks. Recently, the African region has conducted several workshops in country to assess the risk of priority disease. However, some challenges are met in the region to implement One Health approach and using appropriate tools. Among all of these challenges, we have the weakness of health system. This virtual workshop on adopting a One Health approach to zoonotic disease risk assessment and risk communication is crucial to sensitize professionals on the added value of sharing knowledge and to join force. Colleagues and partners, I encourage all of you to actively participate to reach the objective of this workshop. And I am here with WHO colleagues to work as member of this partnership in order to build the African region health system. Thank you for listening. Dr. Traore, floor up to you. Thank you.
Okay, thank you very much, Dr. Baïlo, and thanks a lot, colleague. We have heard about the panelists now, the high-level panelists, and we will move to the first session. But one message to take is really the three speakers just outline how important the partnership is to address global health security issue.